Hi, everyone. I'm Dr. Miriam Smith, the, the host for Empowering New Nurses. And so today, as many of you might have known, that I have my book was released in August 2023. That's this year, that's a few months ago. And many new nurses have been empowered by using it. The encourage are there to help new nurses definitely gain confidence with the contents that are in here in order to provide high quality care to all patients. Now, there are some tips here that I want to just emphasize and under the caption that says new nurses, tips for new nurses, tips for nurses. So I think I'll read two of them that I've written. And one of them is before leaving the patient, ask whether or not if there's anything else that you could do. And at the same time, make sure that the patient is able to express, you encourage the patient to express their needs. All right. Another one is individual patients are unique and should be treated with respect, value, and they should be valued for who they are and for their individuality. Yes, one does not fit all. So we have to individualize our patient care, definitely with their preferences, of course. And that will help them to be cared for in a unique way. And at the same time, their needs being met and they will be satisfied and the nurse will also be satisfied. There's something about one of the devices that we use that must be checked daily. That is the defibrillator. The defibrillator, right? This must be checked as regular as possible. However, it must be done daily. And the information as recorded according to the policy, it's usually 24 hours. But if it's used, you have to recheck it and that it's in good working order at all times. So practice the use of the defibrillator. Check the manual, do the manual test, and the number of joules that you would use, whether it's 30, well, according to manufacturer, and of course the policy of the hospital, in accordance with the hospital policy, and document that on the log sheet or whatever is provided for the daily checks as indicated on the log sheet. It's always important. And if you are the new nurse in charge and you're not sure, ask questions. Very, very important. So, when there's a code, it's important for you to remember documentation, all information, including the expiration dates of the defibrillator pads and of the content in the drawers, because there are different drawers, but there are different content, there are different things in different ones. So it's good to familiarize yourself with, yes, with whatever is in the different drawers so that in emergency, it will be less time consuming. You will be able to go for it much faster. So familiarize yourself with the things that are in the drawers of the code card. I'm not going to overwhelm you with so many tips at one time. I want you to take them in, assimilate, hold on to them. And as you go, and remember again, different hospitals have different policies. So if you rotate or you go from one place to the other, make sure whenever you're doing the policies for one hospital, you remain with that hospital's policy. Don't take this one to go over there. It doesn't work like that. Okay? So it's important to know where you are and the policy for each hospital or each healthcare facility. Thank you. I'm Dr. Miriam Smith with some tips for my new nurses again. And just keep growing, and you will gain more confidence as you practice. Have a good one. Now go on, subscribe. Okay, subscribe, tell a friend about it, and also leave a helpful do leave a helpful comment. Have a great one. Bye.